Shame on
We'll
you.
be on your
Speak to the bay.
Yeah, speak to the
Okay, well, I think we'll,
All right, here we are.
oh, here we go, and I don't know about Commissioner Brown.
He's just, our public works ran for a little long. I think he had to take a little,
Okay.
I just trying to keep it clean. He was drinking a lot of coffee, I'll leave it at that.
Well, I think we'll start with any public comment. Have anyone from the public calling in, Lisa, who would like to speak to us?
I do not see
No?
anybody.
Okay, anyone here in the boardroom who would like to use public comment time? Last time, anyone in the board would like to use public comment time? Okay, we'll close that. And we have no volunteer interviews today.
That's correct.
We will now call the meeting to order. The Tuesday, October 5th, 2021 Olmsted County Board of Commissioners meeting. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right, we will move on to the consent agenda. Approve the September 21st, 2021 Board of Commissioners meeting minutes. Proclaim October 13th, 2021 Minnesota Financial Worker and Case Aid Day in Olmsted County. Proclaim October National Community Planning Month. Proclaim October Domestic Violence Awareness Month. Approve abatement request for parcel 64.04.22.0634474. Approve county acquisition of tax forfeited parcel 64.02.44.021980. Approve the sale of 2 tax forfeited land parcels to the city of Orinoco. Approve MFIP biennial plan for 2022 to 2023. Amendment to the purchase of service agreement with Zumbro Valley Health Center. Approve the 2022-2023 law enforcement contract and community-oriented policing service contract for the city of Stewartville. Approve gambling permit for POGS, parents of graduating seniors.
Move to approve the consent agenda.
Second.
Moved and seconded. Any questions or discussion? All those in favor say aye. Aye. Any opposed? Consent agenda carries. We move on now to the regular agenda. The first item is to approve the supplemental resolution authorizing use of proceeds of $18,655,000 general obligation bonds, Series 2020A.
Hi,
Good morning.
Commissioners. Good morning. Cammie Iverson, Controller for the Physical Development Division. Just a short summary here. We issued $18.6 million in CIP bonds in 2020. $8.2 million of those proceeds were for the condenser project at OWF, why Matt is here. Due to scope change and other factors in this project, the estimated cost is approximately $3 million. So that would leave $5 million in excess bond funds. These excess funds are only available to fund other solid waste projects. They can't fund anything else. But we have to do ask for formal approval from you to use those on other solid waste projects. So some of the larger projects were listed in the board item. The ash landfill cell construction enclosure, a landfill compactor, some switchgear at OWF, fire protection at OWF, and an economizer. There's a lot of other projects also in that list. But again, we're asking for your formal approval to approve the attached resolution to authorize the use of these excess funds on these other solid waste projects.
Thank you, Cammie. Are there any questions?
Motion to approve.
Second.
Madam Chair, just a quick question. These were all in the CIP,
Yes.
capital improvement plan, so
Yep.
we're just getting ahead of
Yep,
what we
yep.
planned, so great. Thank you.
Any other discussion or questions? All those in favor say aye.
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 Opposed? Motion carries. Thank you, Cammie. Thank you for being here.
I'm next too.
Your next two. To approve a resolution calling for the redemption of the outstanding general obligation crossover refunding bonds, Series 2012B.
Yep, again, just a short summary here. So 2012B Grand Marina 4 bonds are the last outstanding tax exempt bonds at Grand Park. These bonds, if you recall, were funded by 4 organizations: ourselves, the county, the city of Rochester, the Rochester School District, and then Rochester Youth Hockey Association. The final payments for this bond were set to be made in 2025, but they do have an early call option on these bonds. So the remaining balance that we have outstanding on the bonds is approximately 1.3 million. Olmstead, our portion of that is approximately 95,000. We're asking for your approval to exercise that call option and to pay these off early. Why are we doing this? This will generate approximately $75,000 in interest savings, but more importantly, it frees us up from the restrictive tax exempt bond covenants about the use of facilities and the amount and type of revenues that we can earn. All 4 organizations have agreed to pay this off early. Some of them are still getting formal approval this week, but they will be responsible to have their portion of the payoff to us before the November 10th payoff. So we are just asking for your approval of the attached resolution to pay off the 2012B series bonds on November 10th.
So moved.
Second.
Been moved and seconded to approve this. Any questions or discussion?
I have something.
Okay.
I'd just like to point out that this has been, we talk about not being able to work with our partners at the city and the school district sometimes, and the private sector. This thing's been going on. How many years? When did we do that? 2007?
2006 or 7.
6 or 7. And we made great improvements to the infrastructure out at Grand Park. And everybody's kept their promises and paid their bills, and so I'd just like to congratulate everybody publicly for doing that. So that's it.
Thank you. Any other discussion or questions? All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you, Carrie. Tammy. C, Administrators Showcase, the Sheriff's Office.
Good morning, Commissioners. Thank you, Madam Chair, and Administrator Welch for allowing us this opportunity to highlight some people. I'm going to take my mask off so I can speak a little clearer. I've got a couple of folks in here that are representative of the 2 groups that I'm going to speak about today. So we're going to get whipping through this thing. The first piece is something you have heard about, I'm certain, at various times. I know that the media has reported on it at various times, and that is the firearm permits and the amount of work that we've done there. And so Lisa Pulowski here behind is representing that group. She's been the leader for us in our office in that regard, and basically knows the process inside and out, and is actually a great advisor to us and even the county attorney's office as they support us in some of these. So I'm going to go through some things here talking about it and get into even some statistics too to highlight the amount of work that these folks have done. So with 2020 being a presidential election year, our 2 front desk deputies, so we started the year with 2 folks, and we've been doing that for a long time, that have handled gun permits to purchase and permits to carry. We were preparing for the typical busy year due to the election, which we've seen and we've talked about in different groups at different times about how as national elections, for various reasons, cause an uptick in the number of permits and people coming through. So then COVID-19 pandemic hit and set in, and due to the state's shutdown, our ADC lobby likewise was closed. And we sat for a while after March 18th trying to figure out okay, what do we do? And the permits and the questions started to evolve, and it wasn't unique to us. Other sheriff's offices around the state were having the exact same challenges. And if that wasn't enough, then on May 25th in Minneapolis, the incident there catapulted into the media worldwide negatively. And in many days, weeks, and months following, society was thrust into the pandemonium that followed, both with COVID and, of course, the unrest that was going on. So due to the pandemic and the record numbers of applicants, we began scheduling gun permit appointments with the help of county IT and the website. And again, that was just something we had talked about, but it hadn't gotten us there. And what was going on last spring, it was really a motivator to get all that done. So for a specific time, so people could then go to the website, sign up for a permit, time to apply for that and come in for their specific time. So there was no waiting in the lobby, and our lobby remains closed today as the process is working very, very well. So deputies Lisa Pulowski and Keith Gottschalk had 14 appointments each day, 5 days a week. Among the other duties that they have to do at the front desk of the Adult Detention Center. They both altered their vacation plans to be at work to process all the permits we were receiving. We have a limited amount of time that these have to get done in by law, so you know, there was a lot of pressure on the two of them as the permits were coming in. We also had 2 other deputies who were on light duty that were assigned to assist them with the large number of permits. For most of 2020, appointments were booked out 2 or 3 months in advance, and it's slowed now, and I think we've rounded the corner on that, but it was again a huge process. We were receiving complaints about the length of time it was taking to get a permit, in the sense that not that once the permit was handed in, but how long it took someone to get it. And it took some time, and for people to realize that they needed to schedule their appointment earlier to get it ready so that when their permit was about to expire, then they would be on time and it would be up to speed. So it took some time, a lot of phone calls, and I know Lisa fielded thousands of those phone calls. So we recognized this also and began taking permit to carry renewal permits at our work release facility. So just a brief understanding here, permits to carry renewal don't need as much work to be done to get a renewal. So we separated those out and trained up a whole bunch of staff in the work release facility who were already there. And of course, the court stuff was not up to speed fully yet with all the construction was going on up above. The work release numbers were down, so it allowed those staff to handle those permits, the renewal portions, and that helped out a lot over here in the ADC for these guys to continue doing what they need to do with the new permit requests that were coming in. So our 8 deputies and corporal assigned there had been processing the renewal permits for the past 9 months over at the work release facilities. So permits in 2021 have continued at a record pace. We've already processed a record number of permits as of September, so that's what last year looked like. And then I have the next slide which shows what last year was in the top or in the bottom, and then where we are to date as of September. I believe it was September 1st or the end of September. So due to the hard work of our staff, we are keeping up with the record numbers of getting them processed in a timely manner that's required by statute. So the permits, again, just a side note, permits to purchase are valid for 1 year, and permits to purchase are free, whereas permits to carry are valid for 5 years. So it'll be cyclical in a sense that all the people that got them in the last 2 years are going to be coming back and you know, we'll be having another increase, or we'll see that bulge again next year as we move forward. So I just wanted to take this time. We've talked about these folks, and Lisa's the one that is the front and, in essence, our face of permits in the county. You know, she doesn't like to be out in public. So it's taken a lot to get her here today. So thank you, Lisa, for the work you've done and the whole crew. Because not only was she doing her job, but as all these other people were getting trained up to do these permits and do those backgrounds, she was training these people too at the same time. So again, kudos to Lisa and the whole crew. So thank you very much. And then the other side of what goes on in our office that also.
Jeff, could I, I'm sorry, that last chart, could we just go
Yes.
for a second? I think I just
Oh,
didn't track
I went
for
the
a
wrong
second.
way.
Other way,
How
yeah.
do I go back?
Well, the
There should
question
be
I have
another
is,
arrow on
is that year-to-date?
This other arrow?
Yeah.
Yep.
Yep.
How sweet that
One more.
is. There, this was,
This 2020 was the year, full year, and
yes,
2021 is year-to-date, correct?
right.
Okay,
So the
thank you.
top line is 2021. So you can see how much more we're already ahead, and that's only, 9 months of the year. And then I think the prediction would be, the permits to purchase, maybe it slow down a little bit, whether we meet that number. I don't know, Lisa probably could say yes or no that we'll reach that.
Typically, so it's hunting season, so they'll start.
Oh, it'll spike up again.
Oh, that's right.
Yeah. So, yeah.
Okay, thank you.
See,
I
on
just wasn't
pace.
sure if that is year-to-date for 2020 or it was year-end. Thank you.
Yeah, that's reflective of the entire year. Thank you. Good question. I should have clarified that myself. All right, we're going to jump to the other side of the office again, one of our places that doesn't get a lot of attention, but we couldn't do what we do without these guys. And there's two of them, and they just do a fantastic job. So the Olmsted County Sheriff's Office has 2 full-time mechanics, Josh Morris and Shane Yo. Part of their responsibilities include maintaining a fleet of approximately 96 vehicles, and that's not just all squad cars and things like that. It's boats and snowmobiles and ATVs, UTVs, the whole bit. Additionally, they support, I kind of jumped ahead of myself. Oh, there's also generators in there too. I forgot about those. The mechanics have no work shortage with vehicles being rotated in and out of the fleet routinely with maintenance requirements, repairing damaged vehicles, and then the equipment inside those vehicles. In a typical year, the Sheriff's Office purchases 10 squad cars that require 50 plus labor hours to transform that car, which is a basic car, into an emergency vehicle. And you can see they basically tear the thing apart, put everything underneath, so it's obviously not hanging out and getting in the way, and it's just a lot of work that goes on to make those squad cars do what they need to do. So when COVID came to Olmsted County and into workplace normalcy as well, we knew it changed, including the mechanics' duties. While several county employees relocated to working at home, the mechanics' workplace confirmed the opposite. They were asked to ensure the safety of our staff and community members when our squad cars were involved. As a result, our mechanics assisted in creating a decontamination station, we'll get to that spot, that deputies and squad cars could use. This is just a couple of pictures of the outside. It's one of the county buildings. I think it's building 41 or 42, if I'm not mistaken. Mechanics spent more time physically being in all the deputy squads, which means taking an additional risk themselves. They helped to find and implement new technology, including ozone cleaning machines that could neutralize viruses in vehicles. The mechanics would ensure the squads were cleaned and sterilized every week and whenever suspected contamination took place. They were assigned on an on-call status during that time where they were willing to come in any time, day or night, including weekends, to keep everyone safe and healthy. While learning how to work through the COVID, the usual daily demands of the mechanics continued. In essence, the workload of the mechanics was magnified because of COVID. We asked them to do much more, and yet they delivered. So the dedication of the Sheriff's Office mechanics exemplifies the office's mission of providing quality services that promote and protect the well-being, safety, and security of all people in our communities. And Josh Morris is here today representing two of our mechanics. So Josh in the back, you can wave. Thank you very much. So those are our guys and the people that we wanted to highlight for you today. They're doing great work and behind the scenes, but again, we couldn't do what we do without them. So thank you very much for this time. Appreciate it.
Thank you, Kevin. The thing that, I'm going to make a political statement here, that we've seen now trends for this mandate, vaccination mandate, et cetera. And the thing that is disturbing, and it should bother people, is that we're now in certain states, not here,
but people should be incensed about the fact that we have put public safety, healthcare workers in front of people for the last year and a half plus, right, before vaccination was ever there. And now telling them that if you don't get vaccinated, you can't come to work or you get fired. This should be a cause that people should be pretty upset about, because we put them in front of infected people for months, a year and a half, and now we're telling them, school districts and others that have been public facing, that they got to get vaccinated or they're going to be fired. So it's one of my little bugaboos right now, and it bothers me about this whole trend and direction about that, and not in recognizing individual decision, liberty, and so on. That's all.
Thank you. Okay, we'll now move on to public health presentation.
I agree. Good morning, Madam Chair, members of the board. My name is Graham Briggs. I'm the Director of Public Health for Olmstead County. I'm just going to give a short introduction for Megan Sheridan, who's joining us here today. If you recall, last meeting, the medical examiner came and provided an annual update on deaths in Olmstead County. The medical examiner's office is one that we've been working with more and more, over the last couple of years now. And so something we thought we could do for you today is talk about how some of this information is applied in public health, and how understanding deaths along with emergency room visits and cases that are reported of disease or other things that we can monitor, we can actually prevent future deaths from happening. And so I think Megan is going to talk about a couple of areas that we're actively working with the medical examiner on, both to look at the quality of the work that we're doing in this case, and then inform the work that we're doing as well. So with that, I can turn it over to Megan. For those that I think everybody here is probably aware, but during the pandemic, we did create a new program in public health entitled Epidemiology, Surveillance, and Preparedness. And so Megan is the new manager of that program. That's basically our data group. You can also call it ESP for short, which seems to fit for the work that she does. So Megan, do you want to come up and provide an update?
Thanks, Graham, and good morning, commissioners. So what I'm going to do today is talk through a couple of areas where we've taken medical examiner data and starting to kind of bring it down and ask questions why around. I will like to also say this little new bump of COVID, the summer wave that they're calling it, did stop us from going as far as we want, because the team that was going to work on this got redeployed for COVID. So we're still in the process, but we've been able to pick up a couple of things. All right. So what I wanted to start off with is this concept of chief health strategist. So I believe Graham has talked about this in the past. This is part of Public Health 3.0 and moving public health into the 21st century. And really working with the medical examiner or any of our community partners around data is really where an opportunity for public health to step into this role. So here's a definition from the Public Health Foundation: is the community chief health strategist is engaged in a change leader, a group of leaders who builds community coalitions that investigate to take action to make meaningful progress on a community health issue. And so I think with working with the medical examiner data and what we're going to kind of show what we've started to dive into really is an opportunity for us to highlight of public health really stepping into this chief health strategist. I think it's also important to call out, we at Public Health do not claim to be experts in all these fields. What we claim to be is a great convener, an opportunity to bring data together and bring people together to better understand the issues. So we can't have a public health conversation without talking about COVID, it feels like. So one of the things that I wanted to show is with the medical examiner data, both Graham and I, when we first saw this data, we were like, oh, well, you can see COVID directly here in this from the medical examiner data that they provided last time. So the top is the deaths by natural causes, and then you see the deaths by age group. And I believe the medical examiner did a great job of explaining that the COVID deaths are really in that pulmonary category. So for 2000, and the other important thing is with medical examiner data, they're looking at deaths that happened in Olmstead County, where oftentimes here at Public Health, we look at deaths, Olmstead County resident deaths. So that's oftentimes where you maybe will see some discrepancies in our data, but both provide a really great picture of what's happening in our community, but then what's happening to our residents. So in 2020, you can definitely see that increase in pulmonary deaths. You can see it increase by 104. By the time COVID, at the end of 2020, for Olmstead County residents, we had around 80 COVID deaths. So you can see it's trending there, and I think the remaining ones you can see were definitely probably due to outside of not Olmstead County residents. The other thing we do know with COVID, and it has disproportionately affected our elderly population, and again, you can definitely see that with the increase of those ages. So again, it's one of those things that it's nice to see other data sources and be able to compare and kind of use that as almost quality of assurance of what we're seeing with our public health data and then what is getting reported on medical examiner. So another area we looked at is looking at suicide deaths in 2020. And I want to just call out too, whenever we're looking at data points, we're talking about people, and it's really important as, especially when we're looking at death data, that we need to recognize that we're talking about someone's loved one that has passed away. So for 2020, I believe I shared this slide before. I'm going to just paint a little bit of a picture of what the pandemic looked like outside of deaths and where we're kind of leading ourselves today. So this is a slide from our COVID impact survey, and this is an important slide I want us to remember as we're thinking about what potentially for 2021. So since the pandemic started, we know that more of our residents are reporting poor mental health. Here is that WHO Wellbeing Index that looks at 5 characteristics of cheerful, calm and relaxed, active, fresh and rested, and interested in life. And you can see all those categories decreased in 2021. I also want to call out, we had 28% of our residents, adult residents, reported poor mental health since the pandemic began. So what I'm trying to do is just trying to paint a picture of what we kind of know, and then we'll be able to dive into suicide deaths. Yes.
And how are you gathering that data?
This is from our community COVID impact survey that we did in 2021, at the beginning of 2021.
So they were consistent questions across the 3 years?
Yep. And then we will actually be implementing our community survey in about a couple of weeks, and we'll be asking the same questions for those too. So we'll kind of have pre-pandemic, during the pandemic. I can't say we're calling it post-pandemic, but a different look of that data as well. What we also have is we can look at the Minnesota Student Survey. So the Minnesota Student Survey is implemented every 3 years. So they'll be actually doing it come in early 2022. And so it'll be interesting to see, because what we've been able to see too over the last few years is that increase of adolescents reporting purposely hurting themselves, seriously considering suicide, or attempting suicide has increased from year to year. We also know that there are different demographics when we're looking at suicide contemplation, where we see females, LGBTQ+, not treated for mental health problems, long-term mental health problems, and being food insecure. We see disproportionate rates for people who identify in those categories.
And this is Olmstead County data or state data?
Olmstead County data. Yep.
Thank you.
And there's similar trends if you look at Minnesota data. We're here in Olmstead County, we're not out of line with what the trends in the state are seeing. So those are 2 areas where we can look at kind of what we have in not in real time, but data we've been actively looking at for years. What we wanted to dive into is what we know about 2022. And so 2020 was a little bit of an anomaly when we looked at suicide. So if you see, this is the data for medical examiner. So you can see that suicide deaths actually decreased in 2020. I will tell you, this happened across the state and also across the country. that suicide deaths decreased, but alcohol preventable deaths and overdoses increased. And so that made us wanting to start to dive a little bit deeper to understand why, if you will. And so I did some research, and no one can, right now, there's not a good clear-cut answer of why in 2020 we saw a decrease. I think what everyone is potentially predicting, though, is we will see an increase in 2021, just given that the long term of the pandemic and everything, and really see an increase in what the state of Minnesota calls these preventable deaths. So just like in Minnesota, Olmsted County overdose and alcohol-related deaths increased in 2020, while suicide deaths decreased. And you can see the percentages of overdoses were up by 61%, alcohol-related was up by 69%, and then suicide deaths decreased by 20%. Alcohol-related deaths is kind of a funky category where it can range from fetal alcohol syndrome to acute intoxication to cirrhosis. So it's a very broad category. It also gives us a look at more of that chronic use aspect as well. So here's just a graph to kind of show what we have seen. So from 2019 to 2020, we did see a decrease, and you can see where the drug overdoses and alcohol attributed did increase. I will say too, the Minnesota Department of Health just this week or late last week put out a report that they saw non-fatal drug overdoses increase drastically in 2020. We're in the process right now of getting that data from MDH to really better understand and be able to dive deeper into that area as well. So we got the data from medical examiner, but then we also worked with Vital Stats to get us a better picture and be able to dive into some demographics. So you can see from 2010 to 2020, this is what we're for our suicide deaths. So you can see in 2017, we had 11. That increased to 25, decreased to 22, and decreased to 17 in 2020. The gray line is just a 3-year rolling average, just to kind of give a trend line for you to compare. What we also were able to do then is dive a little bit deeper and look at age. Age is a really important demographic to look at when we're looking at suicides. Here in Olmsted County, you can see that from year to year, we see different age groups. So for example, in 2020, we saw 7 deaths in our 30 to 39. That is an increase from 4. Again, the numbers are small, but you can see the kind of every year we do see a little bit of a shift in our demographics. I will say for the state of Minnesota, while suicide deaths decreased overall, they did see an increase in older people dying from suicide. So what we are trying to do is we know suicides went down in 2020. But what we're really wanting to try to figure out, did attempts follow that same trend? Did ideations continue or go down? And will this trend continue in 2021? So what we did is we reached out to a lot of our community partners. Again, public health, we really serve here as a convener, a gatherer of information, and trying to be able to make some sense out of it. We are not the people in the field doing the everyday work, but again, working as that convener. So what we did is we reached out to mobile crisis, we looked at law enforcement, crisis intervention, so we were able to get data from them, and I will tell you, we didn't really see anything to really help us answer that question. What we saw is from year to year, we have seen that natural increase, but it wasn't necessarily a dramatic increase that potentially would say something was there. One project we have been working on through COVID is Syndromic Surveillance. Basically, it's a fancy name for saying being able to look at hospital emergency department data in real time. So Olmsted County is actually the first county in the state of Minnesota to get linked up with the CDC and the Minnesota Department of Health to pilot looking at syndromic surveillance. The key piece with syndromic surveillance has been, we can't look at historical data. We can only look at data from the time that switch has been. So we really need like a year or so to really be able to make sense, but we've been able to start to dive into it, starting to look at ideations and attempts We have a team or a person in our health promotion who's really focused on mental health and substance use. So we've been able to actually set that up to start to send us alerts when we're seeing an increase of overdose coming or suicide attempts coming. We also have been working on getting hospital discharge data. We have dabbled in that a little bit, but it's a really of a monster of a data set. Like, don't get me wrong, I would love to just sit for a week and be able to like look through it, but it's gonna take some time. But we have it, and we know that that's gonna be a really rich data source once we come out of the pandemic and be able to start to look into it. We also we have 2 people in the health department who have received appointments to the Rochester Epidemiology Project, and who can, so now we don't have to go to the Rochester Epi Project. We can go into their files and be able to start to mine and look at our own data too. And so we're starting that process of looking at suicide attempts based on medical records as well. So that's all the data we have. The asterisks there are saying we need some time. We need not COVID to be so prevalent in our community for us to be able to dive into it. But we started to build this process of being able to start to layer data to get the best picture, or to get the best understanding. What we're hoping to get is we're working on getting emergency department data. Like I said, with syndromic surveillance, we can only look from the time it was switched on. We do want to look and get some of that historical information too. And then the 2020 vital stats. So the suicide data I showed is preliminary. At the state level, they are in desperate need of some staff to be able to show and provide the vital stats data for not only for the state but for counties. So we're really hoping to get that and just to be able to finalize. But then that also helps us look at the proportions of deaths, leading causes of death in Olmsted County. So that way, again, we have some things to be able to compare when we're looking at suicide data. I have the question mark here too, because what we've been doing is taking this kind of on the road and presenting to various groups to say, you know, this is what we're starting to collect, and then be able to get their impact and their feedback. We actually did this with a coalition that actually had county representation, OMC, Mayo, Zumbro Valley Health Center, really looking at mental health and substance use. And I believe it was Dr. Clemens who talked about of saying, you know, this is what we know for 2020, but we know COVID, and especially how long it's dragged out now, that makes them really, really concerned for what we're going to see in 2021. Again, getting that syndromic surveillance system, working with the ME, getting that process set up too. What our goal will be is we'll be able to start to track even deaths in real time, so we were able to get a better understanding of that. So what I wanted to just highlight too is our current efforts. So we, like I said, we have the data piece, but then we also have a lot of people in our health department who are actually working on suicide prevention right now. So the Community Health Improvement Plan has identified youth suicide prevention and mental health care access are the top community health improvement strategies for moving forward. We also received an opportunity to participate in a mental health promotion and suicide prevention strategic planning cohort. So the hope is with the data we collected in this about a month and a half, we'll be able to be given to that cohort, and they'll be able to dive deeper into it, reach out to more community partners, and be able to develop key strategies in a more comprehensive process. But then we also have our continuous work here with our school-based nursing and our healthy children and families teams as well. So at the end of the day, this is just really more of a practice or a pilot of being able to take ME data that we saw and being able to start to dive a little bit deeper and start to ask questions and pair that with the information we're gathering, but then really, again, an opportunity to hear from our community partners too and get their key insights. Because again, they're the ones doing the work and who can provide that, help understand what we're seeing in the data much better than we could ever do. So that's just kind of an overview. I'm happy to answer any questions that you all may have.
I have a question.
Yes.
Thank you very much. What of the numbers that you gave us is associated with terminal diagnosis or chronic long-term pain?
That's a great question, and that's another opportunity, or where we've worked, or now we're working with the medical examiner to do more of a chart review. So we can only get so much information from basically a line list of information. So we're actually working with them now to understand veteran status, because that got brought up in a group to understand, because we know suicide deaths or there's a disproportionality there. But that is another thing. We did do a deeper dive a few years ago, and I don't want to say a percentage because I don't want to tell you the wrong thing. I will say though, when we look at, it's very dependent by age group too. So you can see what we know is in the older age group, that's probably more of a cause or a reasoning behind it versus what we see with our younger deaths.
Would that also be associated with some form of palliative care?
I can't answer that, but I can definitely look in. We can look into that. But that's the key thing of having this strong relationship with the ME, is being able to take these questions and readily have access to answer them.
Well, I really think that that's a public health question that's going to be with us more than it has in the past because of the aging population and choices that some aging people would like to have depending on their physical conditions and diagnosis. It's one of the last things that they can have control over.
Yeah.
So I don't know if that's part of the plan. Oh, I see back there. Yeah, I see it.
And again, this is the whole point of developing these strong relationships, is being able to go and ask them without having to jump through a lot of hoops, if you will. Just being able to go and be like, oh, can we look into this? Can we look into this? Can we look into this? That's what we're really hoping to, as these questions arise. We know exactly where to go get that, and we have that relationship already built, so we can get that information, that turnaround of information faster than what we've normally been able to do.
Thank you.
And Chair, there is an effort underway at the state level to look at redesigning public health for the future. And Graham Briggs and I are actually on a work group that's looking at how funding that the legislature put together or made available will be used. One of the questions that keeps coming up in my mind is, we have a lot of capacity here. We have you as a specialist. We have relationships with, really strong healthcare providers. Do you ever find that the state, so the question is, what should the state do? What should be done at the regional level? And what should we expect counties to be able to do? So you've just described that we are the first in the state to be able to do this. I forgot the word of the name of the process of getting accurate, immediate data. Do we ever find that the State Department provides epidemiological analysis that alerts us to what they consider an outlier in or of concern in our county or our region? Is that a function that they do yet?
In some capacity. So when we look at epidemiology at the state level, they're in a lot of different brackets, if you will, or branches. So I know I can speak from our infectious disease and our environmental health, or like our foodborne. We have really strong relationships with them, and it's very much of going back and forth of us alerting them or them alerting us to it. When it comes to these broader trends, I would say that's an area that we're working on. I will say getting syndromic surveillance up and running we were able to do it because we had a strong relationship with this state. And so what they're really hoping to do is show that counties can get this up and running in partnership with MDH and then CDC, and being able to expand that to others. So it's very dependent. I would say, would we like to have more opportunities for collaboration or easier access to data from what's coming down from the state? I would say yes. I would say COVID, I think, has kind of opened us to these opportunities of really being able to show what locals are able to accomplish too. I will also say, in echoing your point, Commissioner, we have a lot of capacity here. Even if you were to go to any other county within our southeast region, they do not have that capacity right now too. So it's really, it's not like a one size fits all. And I know other counties, they rely heavily on MDH to provide that information to them.
So one of the things that I'm learning as we look at these questions is that public health is evolving from having to provide clinical services, for instance, to more analyzing what's happening in a community, what are its particular health needs, where people aren't healthy, and then working to make those changes. That's the health strategist piece of it.
Yep.
But I'm also coming to appreciate that if I'm in a county of 6,500 or 20,000, it's very different than a county of 160,000. So I just want to kind of call out to my colleagues on the board that one of the questions before us is, as a state, is how do we build a system where there's a base level of public health service in every county, irrespective of size, that there are resources available at a regional level that those counties can either collaboratively do or draw in when they need it. And then there are some things that the state should do on behalf of everybody. For instance, you may or may not know there's a state public health laboratory, the only one. We only need one in the state.
Yep.
So this discussion as a region, as a county with resources and really deep roots in public health, I think you can anticipate that in the future there will be more discussion about what role do we play to support public health regionally, just like we've done with mental health, or we've done with some other kinds of services where we have collaborative arrangements with other counties. There's no discussion of that happening now, but I'm giving you a little forecast for the future that if we're going to have a really strong public health system in Minnesota, the smallest counties need to be able to do what the counties like ours are able to do. And we all need to be able to look at what sort of the statewide needs are, statewide trends are, and deploy our knowledge and expertise so that you could be, so your zip code doesn't matter as much as it does now. So that's why I'm trying to figure out what you're doing and how that fits. So we're not really doing anything regionally at this point.
We have a regional epidemiologist from this. So there's a epi for each region. So what has happened is his name is Jacob. He's much more of a consult for us and kind of like our person to go to if we have a question from the state. But since we have the capacity, that actually has allowed him to be able to spend more of his resources with other county health departments that maybe don't have the resources like we have, like doing all of our COVID case numbers and surveillance reporting and things like that. He's able to provide that resource more for the rest of the region while we're able to take care of it here. So there's resources, but it's not in-house within a department. And he's still serving at 10 or 11 counties, so it's maybe not as robust as what we are still able to do just as our own department.
Thank you.
Any other questions, comments? Thank you, Megan.
Thank you all.
And now we move on to one Olmstead update.
Madam Chair, before, while the public health people are here, I just want to say that I've been hearing some really positive things about the staffing for the joint work group between the Human Rights Commission and the Public Health Advisory Board on the question of race as a public health issue. And kudos to the staff that have been working on it, because the citizen members have been very impressed and are feeling very optimistic about the work they're doing, although I'm not sure when we can anticipate them concluding their work, but I'm hearing positive things about our staff, and I just wanted to share that. All the staff are here.
Thank you.
Okay, good morning, Madam Chair, Commissioners. I'm Lisa Morris Homesteader, and here with me today, we're going to kick off the One Olmstead update, and we're going to keep it brief. And just to remind all of us, this is the One Olmstead resolution. The One Olmstead resolution was unanimously passed in 2017 by the same 7 county commissioners that are on the county board today. This resolution has identified the commitment in order for us to create health equity, racial equity, and social equity, in order to guide us for the priorities and values that the county has.
So if you're wondering, what does this mean and what does it matter? First, we've put a couple of visuals up here so that you can look at what health equity, social equity kind of encompasses. It makes sometimes a little more sense rather than me reading definitions to you. But one of the things that we know is that Olmsted County is a very diverse community and continues to grow quickly. At today's Committee of the Whole, you're going to hear a presentation about the community indicators that reveal the current community demographics and the current community disparities. One Olmsted works to embrace diversity, equity, and inclusion and eliminate disparities both as an employer and within the community.
Just a minute, Lisa. Is that what
We do this by creating policy practices, systems, and services that hopefully will provide health, social, and racial equity to all of our colleagues and to our neighbors. So, how are we working to achieve health, social, and racial equity? Well, today we're going to highlight just a couple of the many efforts that are taking place across the county. I cannot stress the many efforts enough. We're going to start with the joint study, which Commissioner Cascaden just mentioned. And we have Amy Liebel, the management analyst, or one of the management analysts from the Policy Analysis and Communications team here to share a brief history of how the joint study came to be and to provide you on an update of where the work is at. Amy?
Good morning.
Gotta bring a laptop, right? Gotta make sure I got my timeline here, got some more slides here.
If you're comfortable, you can take your mask off when you talk. Otherwise, it's up to you.
Thank you. Thank you. I appreciate that. Quick training here, Lisa. Do I just hit arrow? That one. Okay. Thank you. All right. Good morning, Madam Chair and Commissioners. My name is Amy Liebel. I'm a management analyst with Policy Analysis and Communications, and I have the honor to lead the project of racism as a public health issue. Our first slide is just a quick background. August 4th, 2020, this board in front of me, you passed a resolution directing the Human Rights Commission and the Public Health Services Advisory Board to study racism as a public health issue, bring your findings and recommendations to you, the county board. So that happened in August, and then shortly after that we had a facilitation with both of those advisory boards to design, develop that journey map to bring that next level, scope out the work, if you will, and identified three focus areas: scope, data, and community engagement. And we created a charter, which of course is absolutely available for anyone that's interested. And from that, we identified a subgroup of 9 volunteers from both advisory boards. This is the same 9 that has been with us since we first had our meeting on January 20th. And during that time, we also have Commissioner Tyne has been assigned to us in an observer advisor role, which has definitely been very helpful to our work. So thank you. What's been happening is about since February, we have brought speakers from within this organization. In keeping with the charter, one of the items in there is Olmsted County Program Services data. And so since that time, we have brought speakers from our organization to talk on their programs, their services. There's many in this room that have come. So that very much appreciated. They're coming to present to us. And so right now we're at this time where they are starting to review everything they've heard, they've read. A number of documents have been shared with them, and they are in work to do work sessions. And so what I share now is our tentative timeline for the next couple of months, leading us into the spring. So right now, like I say, they are in small group work sessions. They're facilitating them themselves. For the next 3 Tuesday evenings, I'm running breakout rooms, running those meetings for them as they chat it out, talk it out, start identifying those draft recommendations. Then our aim is by the end of the year to have a good formulate those draft recommendations, and then beginning of the first of the year, bring these to the advisory boards, share them with the Human Rights Commission, Public Health Services Advisory Board, internal staff, our department directors, and to hear that feedback.
Can I ask, Amy?
Yes.
There's a list of the makeup of those people. What constitutes a sponsor?
Sponsors supporting the work are advocates, so Heidi Welsh, Julian Curry, Graham
Okay,
Briggs.
I see.
Right,
Thank you.
absolutely. And then, thank you for that reminder, just friendly reminder, those directors are the directors assigned to those advisory boards.
Mhm.
And next, starting about the first of the year, implementing or deploying our community engagement plan. Now, just so you're aware, in the fall, a smaller subgroup, or summer to fall, a smaller subgroup has met and identified what that plan will look like. Very much who community organizations, engaging with the community. I know they're looking at the community connector to model that was used in the census efforts as well as with COVID, our public health department, how they deployed that method. And so then they'll start on that, getting that community engagement, hearing the feedback first of the year. Abby Tricker is leading that effort. And then our aim is to bring recommendations to the full board by spring, around April, May.
Good. A lot of work to do.
Any questions, or I'd invite any questions that come up for you as you're thinking, please feel free to reach out.
Well, at this point, no, Madam Chair, but I didn't realize you were presenting that. I have heard really positive things about the work that's happening. People are feeling positive about the work. I have had a complaint about how long it's taking, but not from someone on the task force.
Thank you very much.
Thank you.
Thank you. All right. Lisa, was there more?
Yes, up next we have Sarah Stevens with us. She's going to provide updates regarding diversity, equity, and inclusion work that is happening in public health. Sarah?
Good morning.
Morning.
Thanks for having me. So I have the privilege of talking about the work we've done in public health over the last year-ish, almost a year. So although we've been very busy, we've managed to put this work as one of our priorities. So what we have done is we've developed and completed our cultural competency for diversity, equity, and inclusion work plan. So this work plan will be the cornerstone of our diversity, equity, inclusion work going forward. So included in that is an action, or various action items that we can work off of. So we also had the opportunity to assign a public health liaison to assist and facilitate the joint study work group with Amy, and that's been going very well. We have also created and posted a Healthy Children and Families Home Visiting Advocate position. So this is a position that we're really hoping will be a cultural liaison between communities of color within Olmsted County and then our home visiting team. We've continued to do a lot of work with our public health Little Dig group, so that's our diversity and inclusion group. So this group focuses more on the education and training component. We've also used our partnership with the YWCA, and we had them come in and do a presentation on racism as a public health issue to one of our general staff meetings at Public Health, and that was really well received. So we've also worked with YWCA to utilize them within our work on reaccreditation. So as part of that work within our reaccreditation process, there are some domains that really touch closely on diversity, equity, inclusion work and providing cultural competency. So the leads of those domains, we took them and we completed the IDI together, which is the Intercultural Development Inventory. We wanted to really ground them in the practice, so as they move forward with their recommendations and their planning, so that would be grounded in DEI work, and that has gone really well. That same small cohort that did the IDI, the YWCA facilitated 3 more strategic planning sessions with that group to help them kind of dive into specific topics. So that's what we've done. In the future, in the next 3 to 6 months, part of that work plan that I referenced earlier, a big component of that is creating an equity action team. That, I guess I should say, that name isn't finalized, but that's what I'm calling it right now. So this team will be internal and kind of help further operationalize the DEI work plan itself. And then we have tossed around the idea of starting a second cohort to do the IDI and again ground some of our staff in some of this work going forward. So that's what we've done. Any questions?
I have a question.
Commissioner.
Yes.
On the Healthy Children and Families Home Visiting Advocate.
Mm-hmm.
So how will they advocate? And who do they advocate to?
It's a good question.
And then what's going to happen after they advocate?
Right. So our thought is that we would love to have a person from a community of color fill that position, and then they would work within our team, and then they could be an advocate, so they could, explain kind of what home visiting is. They could teach the nursing staff maybe about this specific community, customs, cultural components, etc. So there's a familiarity and there's a comfort of it's not something, home visiting is not something to be feared, but something that is a tool to be used. So that's the hope. We'll see how it goes, but.
All right, well, we have many cultures. So
We do.
Do you want to have an advocate for every culture?
Exactly, yes. But we understand that, and we felt like we had to start somewhere. So we'll reassess as we move forward.
Well,
Yes.
no, I compliment you on getting
Thank
started. You always have to get started, so it's a good start. So
Yes, I wish
we'll
we could have
follow up.
someone from every culture, but yeah.
Those are very important things. In-home family therapists need to have that information to know how to relate to the families, where to sit, take off your shoes or not, do you show the bottoms of your feet or not, do you touch anyone or not, who do you look at? There's so many ways to make people feel comfortable, and once that happens, then you can begin a real conversation with the family when that awkwardness is past. So I'm very pleased that you're doing this, and I think it's complicated because there are so many unwritten rules and expectations within cultures that that have to be discovered. And so I'm happy that you're doing this. And Commissioner Wright is right. We have a lot of diverse cultures in this community that are now and then needing some home visits. So
Well, thank you both.
Thank you for that.
Yes, absolutely. Thank you for your time.
Well, talking about diverse community, we're going to talk about the Welcoming Week. The Welcoming Week was a huge success this year. Olmsted County, in partnership with other organizations such as the City of Rochester, IMMA, Diversity Council, Human Rights Commission, the Youth Commission, and many other organizations, just came together in order to bring communities, connect communities, and also build a community where everyone feels welcome. Feels that they belonged. Olmsted County participated in 2 events, and you can see it on the photos here. One was the resource fair, where we had more than 200 people who attended. And also hosted here in this room, it was the citizen celebration too as well, with 18 new citizens were recognized and celebrated for becoming as citizens. It was so glad to be part of this event. It was beautiful to see the community and many organizations just coming together in order to make our neighbors, your neighbors, being welcome and let them feel that everyone is welcome here.
Okay, so you may recall that earlier this year, Olmsted County purchased what is called the Bold and Inclusive Conversations curriculum. This curriculum was created by the Winters Group, and you can see up here it was to establish common ground, to help us to learn how to listen to understand others, to allow room for all voices to be heard, and to provide a foundation of respect, along with a desire to learn across our differences. So I'm really excited to share today that we now have 16 certified facilitators of these conversations in Olmsted County. We are currently wrapping up the first 3 cohorts, all led by county employees. So over time, we anticipate that all employees will have this opportunity and that together we'll learn and grow through our interactions, and that we will learn how to celebrate difference and to hear the stories of those whose experiences differ from our own. So I'm really excited. We'll bring you more on that in the future. And now Clara is going to share with us a really exciting new opportunity in Olmsted County for employees, the Olmsted County Alliance Groups.
Yes, this one is very exciting. The Alliance Group. This is employee-led groups with shared identities. We have sent an email with a survey out to all the county employees in order for us to identify which groups that they want to develop for the county, since this was the first year or the first time we were going to start Alliance Group. What you can see on the screen in front of you is the 4 groups that they were identified by the employees, and also the facilitators that will be studying these groups. When we talk about shared identities, I just want to offer some examples. When we talk about the BIPAC, that's somebody who's identified as Black, Indigenous, or people of color. When we talk about the mental health group, those are the people who identify as having mental health concern or who had mental health concern in the past, do as well. And you can see the other words too, alliance group. That can be anyone who would like to support any other community or marginalized communities. That's what allies. So any employee who's interested in being part of or with the shared identities, they can be part of these groups. Let me see. Through this group, not only they can share identities, but also can share resources, they can support each other, or they can build a community that is outside of the formal work environment they already have. The mental health group actually started in September. It started last month, and the other 3 groups that will be starting this month.
So in the past, we've shared with you that One Olmsted is made up of membership from across the county, and we're really excited that we get to have 5 individuals from the Human Resources team within One Olmsted. They can't be with us today, but I'm going to name them anyway, Neil Dennison and Sarah Welper, and we're going to show their picture to you very large like that, just so that we can acknowledge them. But the good news is Julian is here to explain to us, Julian Curry, a little bit more about the efforts that Neil and Sarah have been working on in terms of the first day of orientation and ongoing onboarding for employees. Thanks, Julian.
Thank you. Good morning, commissioners. Yes, so we've got 2 key HR members presented here with some strong efforts around this theme that you're hearing today, inclusion. You heard inclusion within our community, and now we're trying to focus on inclusion within our workforce. So Sarah Welper is part of our personnel team, and she serves on our orientation committee. So we've been reviewing our current orientation structure over the last couple of years, and we've identified some gaps. Orientation currently is a half-day session with many departments coming through and sharing information with our employees. That is very condensed. That is very overwhelming to our new hires. So we are looking to extend that half-day to a full day to give departments more time to walk alongside our new hires, giving them the information and resources they need, cover key technology, key policies that we have fallen short in the past. So that new orientation schedule kicks off December 6th of this year, and we will continue to monitor how that's going if we need to pivot and adjust that agenda schedule. And then from there, we've also learned that going through a one-day orientation or a half-day orientation and going right to the departments is not very inclusive of welcoming employees into the Olmsted County fold, meaning that they focus on their work and not understanding how our teams and departments are intertwined, how we rely on each other and work as a team. So Neil has created a onboarding schedule which will kick off in January, and which we made up of a cohort of new hires. So new hires that are hired in a 3-month interval will go together for the next 3 months, 3-month schedule, meaning once a month, where they will interact with each other, network, build relations within that cohort, but also learn from other departments how they work within our organization and provide additional resources. Key areas in both of these orientations and onboarding will be our diversity, equity, and inclusion initiative.
So, Julian, some years ago, we started a program called the Ambassador Program.
Yes.
And this feels like it's kind of an ambassador program for new hires.
Right.
Are we going to continue the ambassador program at all for seasoned hire people?
Good question. So yes, we're trying to take some of that ambassador model, not as involved as the ambassador program, but kind of introduce that to the new hires with this onboarding schedule. Our ambassador program kind of got put on hold because of COVID.
Yeah.
So we do have plans to resume the ambassador program. Of course, we're looking at ways to expand it and offer more value to our staff with it. So
I also was hoping at some point that we had an ambassador program that was open to the public, in that the public could learn about what we do and our various departments. And I'm not trying. I think I'm not trying to put you on the spot with that. It's an idea that I had, that it would, whatever we can do to let the community know about all the things that we're responsible for and all the good things that we do, if there was a way to do that in an organized way. So it's just something out in there in the ether that I hope we can do someday.
So the ambassador program, I know, is dear and special to your heart there, Commissioner Podolsky. And I like the idea where you're going with that, as far as how can we build on the ambassador program and include the community in that. I know Commissioner Wright has also introduced some ideas around reaching out to the youth and college-age students on how we introduce, once again, tell our story. It basically comes down to being able to tell our story.
Yeah.
And that's going to be very key as we try it. You're hearing about inclusion today. Eventually you hear more about diversity recruitment. And that's the key, is telling our story. So I like your idea of how can we incorporate ambassador program, introduce that to the community as a way of telling our story and the work that we do, as well as the opportunities.
Hopefully our community's going to heal from all of this COVID, and we'll be able to do those things. We are pretty restricted now from doing outreach things, because we have to think about public safety.
Yeah, so I know a little bit of frustration with Neil, and a little bit because he's introducing or prepared to introduce some of these cohorts and some of these training opportunities, and we were hoping to really start getting back into in-person trainings to build that camaraderie and relationships. But we've kind of pivot to try and keep a balance of virtual and in person. But hopefully, like you said, like we heard from public health, maybe down the road here we'll be back to somewhat more normalcy, and we can venture on exploring the ambassador program out to the community, as well as how do we reach our youth and educate them on our opportunities here.
Wonderful.
Thank you.
Any other? Commissioner Cascaden?
I'm not sure when they're done. I have a comment. It looks like Lisa's ready to go.
No,
No, you're done? Okay. So, one thing that is not part of One Olmsted, but now we're hearing a corollary, so we've got the racism as a public health issue. We've got the deep dive looking at how we change the culture within Olmsted County so that we become inclusive and recognizing all different kinds of people with diverse needs and interests. I just wanted to call out for Mark Tynan. I know that the OCJC, the Olmsted County Justice Council, also has a equity initiative underway. It will also take quite a bit of time, and that's looking at equity within the justice system. So I'm looking here knowing that certainly Mark Ostrom and the sheriff and Travis Grancy and others are very familiar with it, but I'm thinking that the rest of the county board is not, and that work will also be ongoing. And then just generally, with all of the issues of the public unrest and the strong public call for addressing diversity and equity inclusion across all of our systems, there are ways that units of government respond that are very visible and appear to respond to an immediate request. And there are ways that I think that we're trying to do it where it's a really deep look at what our systems are and how we change systems and how we change from within. So it's less about communicating to the broader public and more about really taking a deep look at ourselves and how we work together inside of our county government and with our justice partners and with our education partners.
I've got a comment.
Sometimes I think that when we do that, the work that we're doing isn't necessarily recognized by the broader public. And so I'm glad to have all of this reporting today because doing the thoughtful work will really bring the biggest change. And it's not flashy, it's not easy, and yet it really is more foundational to authentic change. So I just think that I'm proud to be a board member here where we are taking that deep dive look in a respectful way and working together to create change. So I just I think I see that Ms. Welsh wants to comment, but I just sometimes I feel like we don't have a position. We're trying to create a culture of change, and that's harder to do.
I think we're trying to model the way.
Yeah.
Commissioner Beer, you had something to say?
Yeah, this stuff's important, and there's a big public call for it. But you want to hear a big public call? On the next time we get a 6-inch snowfall, try not plowing the roads. You want to hear a big public outcry for what government's supposed to be doing. Try that. You want to see it'll be a lot bigger outcall. This stuff is important, but let's not lose sight of what the heck we're supposed to be doing around here.
Thank you. Heidi.
I just wanted to, Commissioners, call out a little add-on to what Commissioner Kiskaden was saying, that you may notice that we have purposely cut a path that does not call for a single position. Lots of organizations, the city of Rochester and many others, have hired somebody who I'm going to shorthand as the DEI czar, somebody who is assigned to that. And we have purposely not done that because we believe it's too easy then to say, well, okay, good, Mark's the DEI czar now, that's solved and I don't have to participate. What the board called for in One Olmsted and what we're working towards is true culture change within the organization. And so it works better as a grassroots. This is what I believe. Works better as grassroots, and so bottom up and top down. It's going to take longer, probably in some ways. It's going to take us this isn't something that ends exactly, but it's culture change. So I just wanted to call that out. That you will see. You already know that instead of hiring single position or dedicated positions for this, we have purposely looked for people for existing positions who know this work, are good at this work, and can participate in this work. People like all of those folks, everybody who has spoken today, are part of this work. So,
thank you.
All right. Thanks for sticking with us. We're almost done.
and finally, I'm so thrilled, really thrilled. That I already mentioned I'm thrilled. I'm so excited that I can share this with you. And this is the official debut about the new employee welcoming video. Okay, so this video actually, we had approximately about 100 employees who participated in the creation of this video. And the time and dedication is evident on this video. Again, it was about 100 employees. Let's see. This video is for the new employee video. This is gonna be viewed for all new employees before even the first day they start employment here with the county. I do want to take a moment, just a quick moment, to thank you for your leadership. Thank you for being part of the advisory board and commissions and trying to make part of the One Olmsted in support of One Olmsted. I also want to thank the county administrator too for their leadership too as well.
And there's one other thing. Oops, sorry, I won't touch that again. Okay.
That's pretty welcoming.
Sorry. Yeah. One last thank you, it's actually two. Among the 100 employees who helped make this possible, it could not have happened without the leadership of Clara Cifuentes and Nick Ryan, who is our media specialist. So I just want to thank both of them for the countless hours they put into this. It's an amazing product, and yeah, thank you so much. All right, take it away.
On behalf of Olmsted County, I'd like to welcome you to our organization. We're thrilled to have you join our team. As a new employee, please know that you and all the other employees of Olmsted County play a vital role in helping us to achieve our mission, which is to provide the foundation of a vibrant community.
Collectively, Olmsted County delivers innovative solutions to help improve residents' quality of life, provides high-quality service with care to the community, uses public resources wisely, and protects environmental resources, collaborates with various partners throughout our cities and townships and beyond. And perhaps most important, Olmsted County is an inclusive, welcoming environment where diversity is celebrated. Attracting and retaining a diverse workforce is important to Olmsted County. Diversity inspires innovation, creativity, stronger work, and ultimately helps us better serve the community. Not only are we passionate about diversity in our workforce, but we are passionate about the diverse community of people we serve.
So let's talk more about diversity, and specifically One Olmsted. Olmsted County's Diversity, Equity, and Inclusion, or DEI initiative. We feel that Olmsted County is a stronger organization when everyone feels included, heard, and empowered. And our administration and Board of Commissioners strongly support One Olmsted and moving its diversity, equity, and inclusion initiatives forward.
As an employee, you'll be invited to attend regularly scheduled DEI learning opportunities. We believe that providing DEI resources to employees will help Olmsted County achieve inclusive excellence as an organization. You'll also have opportunities to participate in small group circle discussions where you can share viewpoints and lived experiences on topics such as biases, marginalized populations, and leading diverse teams. We found these small DEI circle discussions to be very valuable as they have fostered open and honest dialogue and have helped build and strengthen relationships in our organization. Following equitable and inclusive practices is important. So to ensure we're doing that, we are evaluating all of our organizational policies and procedures and making modifications wherever necessary. Olmsted County is also committed to the safety and well-being of every team member.
While we hope you never experience or witness any type of workplace discrimination, there are avenues to pursue if it should occur. One of those avenues is the Red Flag Reporting Discrimination Hotline. This resource is available 24/7, and you can choose to be anonymous if you wish.
One Olmsted is so critical to our success as a county that DEI has been incorporated into our organization's performance management system, known as Olmsted County High Fives. Advancing equity and inclusivity is a journey, and everyone is at a different place on that journey. It is our expectation that Olmsted County employees act with professionalism and integrity, and that means being respectful and civil in your interactions with others. That also means embracing diversity in our workplace and community, and doing your part to ensure that Olmsted County is an inclusive, welcoming environment where diversity is celebrated.
I think you'll find we have a pretty great team here in Olmsted County, and we're so glad that you're a part of it. Just remember,
all are welcome in Olmsted County. We are so glad you're part of our team.
And you belong here.
You belong here.
You belong here.
You belong here.
And you belong here.
Good. Thank you. Apparently, everyone in Olmsted County moves in slow motion. Okay. Thank you. That was impressive amount of information and work that's gone into that in Olmsted already. And we do need our streets plowed. So, Commissioner Beer, you're right about that as well. We take care of a lot of things here. Board and committee reports. We'll start with Commissioner Flynn.
Just a lot of water quality meetings and zoning, nothing to report.
Commissioner Cascaden.
This morning I attended the second of 3 meetings representing Olmsted County and the Rochester area WISE look to the future of how it sees reimagining and re-envisioning itself. Just wanted you to know that's happening in case you want to share some of your thoughts that I can represent you better in those conversations. Several of us attended the AMC Policy Committee meetings recently to start to put together the legislative agenda, and I had the opportunity for the first time to go to the Minnesota Community Corrections Act counties meeting. It was a good conference, and I think we came away with a little bit of a strategy to try and strengthen legislative advocacy around full funding for community corrections. Those of you who are going to go to the district meetings know that we'll be introducing a resolution and a background paper asking to have something added to the AMC agenda around full funding for community corrections, which has floundered in the legislature for quite some time. And then a couple of us were involved in the age-friendly communities report, which since Commissioner Wright was there and it's one of his areas of passion, I'll just say we were involved in that representing the county last week as well.
Commissioner Wright?
Yeah, I had the opportunity to be in San Diego this last weekend and connected to their community administration building. They have an urban playground, which it's really nice to see other ideas of how other communities do things, and that possibly as we're planning Graham Park, some of those ideas might be implemented of how to involve the community in a place that the government provides space for. It was being very well used. And then lastly, many of us were at the Olmsted County Corn Tower celebration, and I'll let Commissioner Beer talk about that. But I think that it did show that there's a lot of affection for the Corn Tower, and that people have lots of emotional connections to it, and that people do recognize it as part of Olmsted County. So, thank you.
Commissioner Beer?
No, I think Greg said it all. I'll pass. Thank you.
Okay. Commissioner Wright? I'm sorry.
Brown?
Commissioner Brown? Yeah, I'm sorry. Just
The new guy. Is there something I'm missing here?
What?
Is there a sign that can't let that go. Other than ready, things are going fine, and great news from very little on ROCOG, but The bylaws are now updated and ready to go to the full board it's been a long, arduous process to update them to modern standards. Thanks to Ben, he's still here, who has diligently kept us moving on that front. It's not a big deal, but it sort of is. That's it.
Let's see, who are you? Commissioner Tyne.
That's all right. I don't have a report.
No report? Okay, well,
She got your name right.
I got your name right, so. Man,
Out of all people.
I'm never gonna live this one down.
Here, listen.
I just did want to say that downstairs, it's one of 3 events that we have to recognize our employees. Coffee and a donut, and it's a token thanks for everything they do, but it's the one way we can do it to let employees know how much we appreciate it and how hard this last 2 years have been with the pandemic and all the adjustments people have had to make. Commissioner Cascade talked about community corrections. I don't know if when people hear that word, if they understand what community corrections means and what the difference is between that and the Department of Corrections. I have been proud of this community since I moved here to learn about our idea of community corrections, and that we believe in restoring people's lives to wholeness, and we do it out of our own levy money because the Department of Corrections has a different set of rules, which we have chosen to do this on our own with. And there are, how many community corrections counties are there now, Travis? Do we know?
35.
35. So I think it was 10 a few years ago. So as time goes by, more and more counties are deciding to do community corrections. And so if the community is watching this presentation and they want to know more about what community corrections means, that's definition of that would be on our website. Is that right, Deborah?
I don't know, I have to check.
Okay. If it isn't, it should be, because I think it's just an important thing that we do here for our citizens. You're just nodding. Okay. So, and
On the spot.
I'm and this is, of course, the favorite part of the commissioners, which they voted not to do last time, but I'm going to inflict it on them anyway. My quote for the end of this meeting, I have 2 of them, one from Abraham Lincoln and one from Thomas Jefferson. They're both pithy but have a theme in common. Abraham Lincoln said, "Be sure to put your feet in the right place, then stand firm." And Thomas Jefferson said, "On matters of style, swim with the current. On matters of principle, stand like a rock." So, with that, I will entertain a motion to adjourn and.
So move.
Second.
Yes. Oh, well, second. I thought you said Stephanie.
No, I'm not Ken.
Oh my
You're
gosh.
right then, Commissioner Cascade.
Okay. The year's almost over, fellow commissioners, and you'll have a new chair next year. Keep things keep things on track. So, all those in favor of adjourning?
Aye.
Any opposed?